Welcome to the Fat Fuel Family Podcast, where every week Danny and Maura Vega discuss topics that help families live a healthy and active lifestyle with their little ones, including nutrition and training, peaceful parenting, education, and mindset. To stay up to date, make sure to hit subscribe on this podcast and check out the blog at www.fatfuel.family. You can also find them on Facebook and Instagram at DannyVega.ms, at FatFueledMom, and at FatFueledKids, and Fat Fueled Family on YouTube. Enjoy the show.
What's that?
Oh, this?
Yeah.
It's just my Keto Brick.
Keto Brick? What's a Keto Brick?
Well, Keto Brick, it's an actual brick, which is awesome because it lasts me a really long time. Can't say the same for you.
Nope.
But Keto Brick is an awesome keto-friendly snack that it could be used so many ways, you guys, seriously. But it is keto-friendly, high-fat, low-carb, has really, really good macros. It's shelf-stable, which I love because I like to take it with me when I leave the house with the kids. And it's got no sweeteners, none of the crap that we're usually staying away from. So no allulose, erythritol, corn fiber, soy, any of that stuff that we're usually avoiding, but it makes such a great snack. I also love it just as a treat. I like to put it in my coffee and the kids love it. So that's a plus.
I totally agree. And I have one of these every single day.
An entire brick.
Yeah, everybody knows I like to crush mine up into cereal and have it like a cereal. My current favorite flavors are peanut butter and chocolate peanut butter cup, which we have right here next to us. What about you?
I really love the peanut butter because it's nice and smooth, but my other favorite flavor would probably be toasted coconut.
Yeah, toasted almond coconut is amazing. And yeah, of course, as you all know, we are great friends with the owners of this company, Robert Sykes and Crystal Sykes. And both of them, when this started, they were just wrapping these things up in aluminum foil and shipping them out themselves, pulling all-nighters, and here we are several years later. It's an amazing company, guys. They have vegan options, vegan-friendly options, as well as whey options. So the two flavors that I mentioned are chocolate peanut butter cup and peanut butter, and the chocolate peanut butter cup is whey, and the peanut butter is with the pea protein. So if you don't tolerate whey, no worries. Or if you're on a vegan diet, no worries. You can have the peanut butter. So guys, click on the link in the description of this podcast episode and check out the Keto Bricks ASAP. It gets the Fat Fuel Family seal of approval. Anything else?
No, that's it. It makes a really great snack. A little trick, I will just give one last tip, is if you want to melt it down, I like to melt it down and put it in little molds to make it just bite sizes for the kids because it's a brick.
It is a brick. Get your Keto Bricks.
Do it.
Dr. Sloane, great having you. How you doing?
Great to be here. Thank you for inviting me to be on your podcast. Very exciting.
Yes.
We are so excited to have you. Thank you.
Yeah, this is the topic we're going to talk about today is one of those. It's like, so many are suffering in silence. So I think what you bring to the table is going to be very, very helpful. So thank you.
You're very welcome. Thank you.
All right. Well, we're excited to get into this conversation, Doctor, but we always lead off with the question, what is the most critical problem that you are currently trying to solve?
That's a really good question. I'll tell you, I'm going to answer that question in the context of my treating ED as a urologist, because I think about this a lot. This is what it is.
Yeah.
So I see this is almost all I do, or a very large percent, is treat men with ED. And I use a lot of treatments, Gaines Wave in particular. I think you know what all that is. That's low intensity shockwave therapy. And what I deal with is there's a 75, 80% success rate. Why isn't 100%? Why not?
Right.
So what's going on with those guys that come in that I turn down a good number of men who I'm clear this is not going to work for. It's not for everybody.
Yeah.
I'm very selective. And even with
good.
that selection criteria that I use, I'm sure it's going to work on some of these guys and they don't. And I rack my brains to why, because I do everything about them. Check their testosterone, full blood work, make sure they're not out of control diabetics, not smokers, maximize their testosterone. Why isn't it working? So I'm really looking, is it vascular? Is it something I'm not seeing? Is it a deeper level of endothelial dysfunction? Is it oversympathetic drive in an anxious man? So that's, in this regard, that's my biggest issue right now that I'm dealing with.
Well, I appreciate that. And I think it's, I know we can't make it into something really simple, but, they always say it's like probably in order of importance, blood flow, and then probably the hormones. And then the last kind of X factor is that mindset or whatever you want to call it. And I feel like that's one that's probably really
the hardest one to deal with.
Yeah, it's like a self-fulfilling prophecy. You're like, I have ED. I am defined by ED, and now I can throw anything at it and it doesn't work. It seems like that's probably like that tiny little percentage that nothing works for. But, I'm glad you brought it up because, when I first learned about Gainswave, I was like, what are you talking about? Why are you reaching out to me? Everything's working fine. And then obviously after I got the treatment, I felt so much better. I felt like, I was 18 again. But one of the things I noticed is that so many men don't talk about this, and so, what are some of the ways men can check if they're performing optimally, whether it's something that proactive that they can do. I know we spoke about before we got on the air, Dr. Brandeis talks about specific, whether it's, we were talking about, keeping blood flow there. And, one of the things is the pump. And then he mentioned, what is the compound that's found in watermelons, and that you can...
Citrulline. L-citrulline.
Yes, L-citrulline.
As a nitric oxide supplement booster, yes, very important, especially over 50.
Yeah, so what are some of the ways, because we know now that we're seeing so many things like, people with insulin resistance, one of the biggest issues for women is, something like PCOS, but then men, it's ED. So what are some of the ways that we can be proactive as we age? I'm 40. One of my closest friends is getting a Gainswave, and we were talking about this stuff, but this is not the type of things that we talk about as men. We don't
right.
see.
True.
Nobody wants to say, hey, man,
nobody wants to. Yeah, well, it's the pride that you go.
As a matter of fact, a lot of times men will come in and I go, "How did you hear about me?" My wife.
That's a good wife.
That's great.
Yeah, that's right. My wife sent me. That's a great question. So I think the way I look at it, you start off with the basics. And I do have to say, I am not a fan of the term anti-aging. I know a lot of people use it. You can't not age. There's one way to do that, and you don't want that way. So,
death.
To me, there is going to be aging.
Entropy,
you're age. You're going to go from 30 to 40, hopefully, to 50 to 60. And your body is going to age to some extent. Now, how you age is to me, that's really the important question. So it's basics, look, and you all know this, healthy diet. How many people eat what's called the SAD diet, the standard American diet?
Many.
And it's a problem because, look, I had a gentleman come in, for example, the other day. He's a night shift worker. And then he's got another job. And he goes, Doc, you know what? I have to eat fast food. Now, I do get that. He probably doesn't have to, but in his world, that's what there is. Now, that's, eating that processed food, loaded with salt, sugary beverages. It's just, if you can cut that out, and that's a tall order for many people, that's one thing. Exercise, however you do it, whether it's HIIT, weight training, resistance exercise, you got to do exercising. I also think it's very important, maximize your physiology, get a full set of blood work. I do that on every man that comes in with ED. CBC, comprehensive metabolic panel, hemoglobin A1C, C-reactive protein, thyroid, DHEA, everything. Make sure that's not just good, but maximized. And of course, there's always testosterone. Many times men come in, I go, did you have your testosterone checked? Yeah. Who checked it? My primary care physician. Now, if that PCP is not tuned in to ranges and levels, he could look at the range of the lab report, and the normal starts at 250. Now, any man and his PCP could look at his testosterone and say, "Oh, you know what? You're normal. It's 275. No, that's low. We use 350 as cutoff." Yeah, exactly. So, what
was the cutoff before? Because I know that they lengthened the range now to adjust for mediocrity.
On the report. I'm sorry, I didn't mean to cut you off, Danny. What was your question?
Well, I was saying, like, I know that as we've gotten unhealthier in this country, we've extended the healthy ranges instead of keeping the standard. So you said it was 350 before?
Well, I think on the let's say the Quest lab, it goes down to 250 as the normal, I believe. But as people who treat ED, I think the American Endocrine Society is 300, and your AUA may be 350. I use 350, and even I think that a lot of us think that's on the low side.
Yeah, it's still on the low
side. So you would want to check that and maximize that if it's appropriate. Those are the kind of things I look at and recommend: healthy lifestyle, maximizing your physiology, and things like Gaines Wave. Yes, they're good to be proactive with. I remember when I first trained to do it, which is about 4 years ago, I was doing it on my patients, and I called the gentleman who trained me at Gaines Wave. I said, I want to ask you something. Is this crazy? Like, do you do it on yourself? Because I really thought, well, I don't have ED, thank goodness, right now. He said, you're crazy if you don't do it on yourself. Because he says it really does increase and maximize your performance. So I think things like this, certain things within regenerative medicine, appropriately can be very helpful.
Yeah, and one quick thing on the testosterone. I know that you're a urologist, but is there ever any consideration given to free tests? Because I've seen a lot of stuff recently on, I don't know why so many men are seeing their testosterone bound, SHBG levels rising. I'm not sure what it's about, but it just seemed like a trend where people could have, where I think they're calling it testosterone resistance or something similar to like an insulin resistance. Have you ever heard any of that, or what could be causing that?
You know what? I'm not really up to snuff on that, to be very honest with you, Danny. I do get confused myself, and I actually just sent an email to one of my colleagues. There's a lot of articles that say you should definitely treat free testosterone when the total's normal, and some say I don't bother with it. I'm right now a bit researching that for myself. I don't always measure SHBG. Perhaps I should. It's obviously elevated in certain people, obesity, liver disease, some diabetics, but I really pretty much have been going by the total right now.
And also there's people with low totals. I know someone, Dr. Baker, low total testosterone, but he's, got no symptoms. It's interesting how.
Yes. Yeah. And that's another question, Danny. What should we be treating the number? I don't think so. Now, the American Urological Association is, if they don't have symptoms of hypogonadism, the patients, ED, fatigue, sluggishness, muscle wasting, osteoporosis, don't treat. They also recommend that if you do treat somebody and they don't get better, stop treating. Now, that goes against many of the current age management societies in terms of treating low T. I also know that there are definitely some men who are in the normal range, let's say 400 or 500, but will do better at a higher level. Those guys do exist. I find it difficult to treat somebody's testosterone if it's low, but they have zero symptoms.
Yeah.
Now, you could argue though, and there is data that correlates low T with increased mortality rates and other measurable parameters. So maybe there's something to be said about that. I think this is one of these ongoing no right answer right now.
Yeah.
But I do have difficulty because I check pretty much everybody's testosterone that comes in that has ED or low libido or fatigue. So you take the man who's 52 years old, his testosterone is 450 and his free is normal. And now I know a lot of people in different age management organizations that absolutely treat that. Is that wrong? I don't know, but I have a hard time with that myself.
Makes sense.
Yeah, that makes sense. Well, our next question is kind of more along the lines of for the women. So as a female, I know how important it is for partners to be on the same page. And so honestly, I was curious as to, what you would say to the wives. Obviously, they're the ones sending the patients, which makes perfect sense. And partners of your patients, what role do we play? How can we help if at all?
Yeah, good. Well, I think that in my experience, it's a very mixed bag of the relationships and how they interact with each other in this regard.
For sure.
I have a good number of men that I had a man come in today. Hi, how can I help you, Mr. Smith? You got to save my marriage. His wife is clearly not okay with this. And, you know, what kind of pressure is that on him now to deal with his ED? And I don't blame her. I get it. You know, I married a younger woman. She wants to have sex a lot. I get that. Who doesn't get that? And I would get that that his wife would be frustrated. But there's got to be some patience on that side of the bed, quote unquote, because otherwise you're just going to make it. It's a little bit like premature ejaculation. If you have patience, I have a good number of patients with that. Now, the harder you try to not have that, the worse that gets. And
it's like the mindset.
If you have a partner that's really impatient, you can forget about it. That's not going anywhere. It's like trying to fall asleep. Go ahead and try to fall asleep. You can't do it. It's like try to not have premature ejaculation. It gets worse. So, so to answer your question, I think patience and support goes a long way. Because the other side of it, the impatience and you better fix this now, you know how that's going to go. Well,
that doesn't help the mindset, which I feel
that's some pressure right there.
That is a lot of pressure. Yeah, that's a lot
you better fix this now.
And one thing about sex, it's anti-pressure. It's parasympathetic, not sympathetic.
Yeah.
So it's got to be, you got to relax, not get all uptight, you know.
Yeah. And I can imagine a mindset is such a huge part of it anyways. It's such a huge, because I feel like once it even happens even once to a man, like just the whole, just the way you guys are, you know, like the ego, I can't imagine.
Yeah.
I'm sure it's just like eats at you guys.
Yeah. I mean, if you have one bad performance, you're like
I'm nothing.
Yeah. You forget about everything else. And it's like, you know, I'm sure, you know, I mean, look, in the MLB, 300 is a good batting average. So
exactly. Right.
We got to do better than that. We got to do better than that 100%. But the fact that, sorry, Danny. Yeah, no, sorry.
You know, sports is a great analogy because a lot of men have performance anxiety. You know, they miss you. I take the example of the outfielder who blows a couple of balls out in the outfield. What do you think he's worried about when he goes out the next time? And sometimes there's sports psychologists to help guy. It's not that he can't play. It's not that the guy can't get an erection. He's now in the vicious circle of, I'm not going to be able to do it. See, I told you, I'm not. And they get into this
self-fulfilling prophecy.
And that's very much a psychological mindset. Coaching would be very good for that. You know, now that's a good, also, I'll use Viagra sometimes with those guys that aren't on it because just to get them back in the game, it's not necessarily dealing with the root cause, which is anxiety, which you really have to get to that. So that's one of the frustrations I have. I tell the guys, look, I'm not a psychologist. I'm not a coach. And you may want to consider that. But a lot of guys just want the quick fix.
Yeah, they do.
So that's the only thing.
That makes sense.
Now, I had a different question, but we kind of covered it already. So I was like, this one just popped into my head. I wanted to get your thoughts on it. You know, like porn has been just so disastrous for so many people. I mean, I think I hear that some people, it helps their relationships, but in the aggregate, you know, it's been so destructive. You know, you see lower zinc levels, lower selenium levels, lower, you know, sperm counts, all those things. And so, you know, is that ever a part of the conversation as far as like, you know, when you're talking, because I'm sure you've seen in the last 20 years with this rise in porn, there has to be a huge correlation between that and the rise in ED. Obviously it's because you're talking about sympathetic and parasympathetic, and that is all sympathetic, you know, it's just like instant, you know. So does that ever come up in the conversation?
It does. When I think it needs to, because it's
right.
Most guys, at least in my practice, are not doing that excessively. And I do think porn has its place. Look,
I know some people.
If you're feeling kind of blah, you need a little bit of pick me up. It's got its place, but it's like anything. You get that dopamine rush, like what is called dumb scrolling through your phone.
Yeah,
satisfaction. That's the addiction.
It's
and that, addiction. As you were saying, Danny, that causes a lot of problems. You know, the whole thing with porn brain. And there is, although I didn't read the article, but there's an article, I think it's the Journal of Sexual Medicine, that the title is Porn Does Not Cause ED. But I think that in certain situations, it becomes an addiction, and it very much does, because some of these guys, they watch porn, and the only thing that's going to get them off are the scenarios that they're watching.
Right. It's
and
not realistic.
if they can't get that, they can't do it. They can't get off.
Yeah.
So that's it is a real problem, like anything.
It depends, right?
Used. Like wine, alcohol. It's great, but become an alcoholic because it's like anything. Human beings, we get addicted to things, and this is what happens.
Well, even in just for me, like in the non-scientific, just common sense thinking about it, I just think about like what you're training to do when you watch porn is you're training to finish fast and you're training to get in and get out, and then like it's almost like you play the way you practice. And so that's just a little sidebar for me, because I'm just thinking like, if you're training to just get in and get out like that, don't be surprised if, you start premature ejaculation or even like you said, it's just, and it's this consistently escalating baseline.
That's what I would think. It's what he said too. Like, that's always what I've thought of, is the fact it's like, well, what are you watching? That can mean a lot of things, right? Like, are you becoming desensitized? Are you watching something that's unrealistic? That's not going to happen in your home. You know what I mean? So obviously like that makes sense. It's going to be an issue.
Exactly right. Exactly.
It's like not enough.
Yeah.
Not enough, never enough. And then, it's that
it's an addiction. Yeah.
Rush. It is. It's really, and like you said, the desensitization. I mean, if you watch enough of something, it becomes like anything.
Yeah.
You stand in sewage for a long enough time, you don't smell it.
Yeah.
Exactly.
Yeah, just like, I would have to, I mean, she would laugh because the amount of, surgeries where it's just you walk in and it's a drape and it's a vagina. I mean, it was nonstop. It became, but it's never the same when you come back home. But yeah, I know what you mean.
Right.
Oh wait, you didn't.
Yeah.
So you have, multiple fellowships, you have multiple certificates and ongoing education that keeps you up to date with like certain lifestyle hacks and supplementation, things like that. Peptides have really changed the game with respect to inflammation, growth hormone, etc. Have you seen any peptides that could improve your patient's success beyond obviously, things like Gainswave and the Phoenix Pro?
Yeah, I love peptides. It's a great field. The unfortunate thing is that the FDA is cracking down.
I know.
On really good ones. And, unfortunately, we're really involved in a society where the pharma has done great things and still do. I mean, thank goodness for them. But, between the pharma and the FDA, they take something like peptides, which do so much good for so many people, and they're really putting the kibosh on a lot of these compounding pharmacies for manufacturing them. And with that said, there's still some pretty good ones out there that can help people. I mean, the one that comes to mind in terms of sexual function is PT-141. That is
141?
PT.
Oh, PT.
P as in Peter, T as in Tom. PT-141. I think it's called Milano Court, something like that. And it's a peptide that you could use for a limited time, a couple of times a week. That's very good for libido and for erectile function. I do use it on some patients. It also has its own set of side effects. You got to be careful because it's related to melanin.
Oh, melanotan. Yes.
Yes.
Yeah.
Melanotan.
So that's one. Yeah. And then there's other ones that are not necessarily specifically for sexual function that are just good for your increasing your growth hormone production without giving you growth hormone. It's much more physiologic, because what peptides are, the signaling molecules that make your body do what it's supposed to do, which is great. I mean, we all love, everybody who's getting into peptides loves the science behind them, loves the possibility of them, the safety of them. Now, there's not a ton of literature on them, but there's enough people in the know doing it, getting results, which is how a lot of things get started to begin with. It reminds me like when I first heard as a urology resident, we only took kidneys out with big, I'm taking a little bit of a left turn, but it's an example.
Yeah.
And then we only made big incisions to take out kidney tumors. Then somebody said, hey, we're going to start taking kidneys out through these little incisions with laparoscopy. And people were like, no, that's crazy. You can't do it. It's not going to be satisfactory. You're not going to get the right surgical margins. The standard of care now is robotics and laparoscopy. So this is how these things get started. My point is peptides are something that people at first said, dangerous, no good. We don't know what they do. It's becoming like that. So I do really like peptides.
Yeah. Yeah. I mean, and it's so cutting edge because even in the last 5 years, if you look at the GHRPs and the GHRHs, like the newest ones, like the ipamorelins and the testosterone, there's no issue with prolactin. There's no issue with estrogen and all these other earlier side effects. I'm salty about the NAD because, you saw the whole stuff.
What happened with NAD?
NAD is now,
oh man, I was interested.
You can't get it over the counter anymore. I think you can still get it if you go to a clinic. Yeah, but you couldn't get like the liposome or anything like that. And I'm just like, so many good things that can help with, especially addiction. We're that's one of our passions too, is the addiction side of things. So let's talk about the Phoenix Pro because, it has several, and correct me if I'm wrong, but you designed the education for the Phoenix Pro?
I had some input in it. I was probably somebody that did a lot more work than I did over at Health Games. I can tell you that. I want to take credit for that, but I was involved in it.
Okay. So it has, what I love is that it has several protocols for different levels and even, optimization, which is where I'm at. Is there anything you tell your patients who want to use the Phoenix Pro in between GAINSWave treatments or as a sexual optimization tool? Like how do you envision it? Like, let's say a patient comes in, they get their 6 GAINSWave, maybe they add in a P shot. How does that, I know it's, different based on the level of ED, but how does that kind of fit into the whole treatment plan?
Yeah, that's a good question, Danny. I'm a very big proponent of maintenance therapy after you do your GAINSWave, because guys always say, how do I keep this up? And I have a lot of men prior to the Phoenix and I still do, on maintenance protocols, whether or not it's once a month, once a quarter, whatever they're able to do. What's nice about the Phoenix Pro, where I think the real sweet spot of it is after you've done the initial gains, although not for everybody. Like I got a call from a gentleman yesterday from Tulsa, Oklahoma. Now he's not going to come here and do 6 GAINSWaves.
Yeah.
He's not near a provider and he functions well. This is not for your severe ED guys. It's for guys that are functioning reasonably well, had their GAINSWave. I like it as a maintenance tool. So if you want to do your gains in between treatments, you may not have to do that, but you want to get another one in between your week, or if you have to miss a week, perfect. I do like it after they finish their 6 or 12 treatments, whatever they needed, to get a Phoenix, treat themselves as a maintenance plan. Once a week, once a month, once a quarter. I mean, there's 50 treatments, so that's a lot of treatments per Phoenixes. So I'm really a big proponent of it with maintenance therapy.
Yeah, that makes sense.
That's how I like it. Yeah.
Stay ahead of it before it becomes a problem again, right?
Exactly. Yeah. Exactly. Like going to the gym. Well, if you stop working out, eventually your muscles are going to shrink.
I know, right?
Yeah.
If only it would just last.
Oh, I know.
Forever.
Maybe it'll be a peptide for that. Who
Maybe.
Yeah.
Yeah. So for the what other maintenance protocols besides the Phoenix do you usually recommend for your patients, and how often? Obviously, I know it's going to depend on the severity.
Sorry.
Yeah. So obviously there's the GAINSWave. There's a low intensity shockwave therapy, which I think you really want to keep up with that, because that is the stimulatory factor that has gotten you from point A to point B. It impacted your tissues at the level that it does, which, the science around it is crazy. It's great. And to stay here, you want to keep that going. Now, everybody's different. I mean, I had a gentleman that come in, a relatively young guy, 40s, but he had ED, was on Viagra, got off Viagra. I haven't seen the guy for 2 years.
Wow.
And I said, what's up? Do you need another gains? No, that's working fine. I want those nitric oxide supplements that you provide. So I believe everybody should be on a nitric oxide supplement. I don't think you have to pump all that often. I'm not a big proponent of the penis pump if you're functioning well and you completed your gains wave. But I think, like we spoke about earlier, keep your lifestyle healthy, exercise, nitric oxide supplementation. There's a few other supplements that are quite good. Pycogenol is good. L-carnitine, good for blood flow. Those are the things that I think that are good for maintaining overall health, because I always tell men, what's good for your penis is the same thing that's good for your heart. Same thing. Vascular.
Yeah. Win-win.
That makes a ton of sense. Well, doctor, we've had a great conversation. We just have one more question. Do you have any upcoming projects, anything coming up that you'd like to share, and where can people find you online?
Yeah, thank you. One thing I'm training myself in is the area of functional medicine. You guys know about functional medicine. I'm sure you do. I love functional medicine because the testing that you can do on people,
it's great.
to discover what's going on under the hood really is fascinating to me. And people, I think, initially thought or still do that. Well, functional medicine is great for those patients that their doctor cannot find out why they feel crappy. Am I allowed to say crappy on the podcast?
Yes,
the people that are fatigued, they have insomnia, they can't lose weight. And every test that they have by their doctor is normal, or they have nothing to offer them. It's also good to we were talking about optimizing your physiology. I do three main tests in functional medicine: adrenal, cortical stress testing, organic acids testing or ion panel, and GI testing. And you can look at pretty much everything about your body that may be working fine, or you may need a little tweaking with supplements. And I also like it because it directs supplements to where they need to go. Rather than, you can go to Whole Foods and walk down that supplement aisle, and boy, everything looks great. You want everything. This is good for your brain. I'll take some. This is great for your memory. This is good for your liver. Give me that. In functional medicine, we really target supplements toward the test findings, which I love. So that's what I'm working on now.
I absolutely love that. We have my good friend Barton has a company called Upgraded Formulas. I always want to say Upgraded Labs, but I think that's somebody else. He does hair testing for minerals, and it's like he sells nano minerals. So it's like really good absorbable minerals, but he says the same thing. It's like, why would you, for example, I had someone that I'm close to calls me up and says they want to take DHEA. And I'm just like, well, have you gotten your levels tested? How do you know what to take? How do you, it doesn't make any sense.
You're just throwing darts in the dark.
Yeah. Like, so I love,
yeah.
I really do love that, because I know we can say that, okay, on the whole, there's going to be an issue most of the time with vitamin D, and magnesium, a lot of these, zinc, copper, but it's nice to get that confirmation so that you can really pinpoint, and you're really just kind of just honing in so much better with all those tests. The other one,
you really do. Especially the stress test too is so important.
Oh yeah,
we're all running, especially now after everybody's gone through it. Like, everybody's stress is through the roof. That stuff affects you more than but people don't understand
hypertension,
how much it affects them.
Yeah.
Like, even just losing weight, because we do a lot of coaching for weight loss. You're doing everything right, all this stuff. Okay, you're super stressed, or you're not sleeping. So it's
That's really cool. Well, doctor, thank you so much. Where can people find you online?
You can go to my website, which is Phila Urology, Phila Urology, not Philly, philaurology.com. Or you can Google me, Bruce Sloane, Sloane, MD, and you can get me.
Thank you so much. We appreciate you taking the time to meet with us today.